The biggest opportunity for Amgen in the coming year is getting approval for our new drug Prolia and launching that so that millions of people around the world will be able to have the advantages of the most important and the most significant bone resorption blocking agent that's been introduced for osteoporosis. We're also filing the applications for our oncology indications for Prolia. Regarding challenges, probably, like most other people have answered, understanding all the consequences of healthcare reform and all the new opportunities and all the new pressures that that will bring as well in the year 2011.
Challenges are making sure that we've got, as this economy comes up, that we keep a sense of an entrepreneurship so that there's new ideas and new people getting involved, and also have an education system that can deliver. We really believe that a big part of economic development is having a higher education system that can deliver the workers, not just the PhD scientists, but also those lab technicians. We've leaned forward with a lot of dollars in that area for Missouri, and I think it will pay off as the economy rebounds.
So the challenges for my company over the next 12 months will primarily be securing the funding needed to move our products forward in preclinical development. It seems as though the environment is shifting towards later stage products with the venture community, and the big farmers are coming in early and earlier to essentially take up what the venture community is missing out on. And we have a number of discussions underway to that end. The greatest opportunity is going to be the fact that the venture community is missing out on that, and that we will get to bypass the venture community and move forward directly with the big pharmas in securing funding through partnerships and licensing collaborations, because that will allow us to avoid the dilution that is required, and will also give us the incredible expertise that comes with working with the big companies and the resources that they have access to.
So I think the most important thing for biotech and early stage companies over the next year is, again, to remain very efficient with their capital and use that capital in a very focused way to try to generate data which will allow them to give them the capability to bring more capital into the company on the basis of that data. The markets are much more stringent about what will be funded both in the public and private sector, so it's very important for companies at that stage of development to be very focused only on products that can create value and bring them more funding.
So the healthcare world is moving very rapidly from a one-size-fits-all world to a world of personalized, predictive, and preventative medicine. And the interesting thing about that is much of that technology came out of the Bay Area. The power of the Bay Area community, the biotech community, the power of Stanford and UCSF and UC Berkeley, UC Davis were leaders in the field. The industry, the healthcare industry, the problems in the healthcare industry can only be solved as a result of moving to a world where we really understand disease, we get preemptive to disease, rather than kind of wait for it to happen and then have a one-size-fits-all world around it. So new technology, genomic technology, technology upstream of the genome is enabling us to get at healthcare totally different. Convenient for us in the Bay Area, we're also the world leaders in some of the bioenergy and biofuels areas, some of the work that's being done both at Stanford and UC Berkeley, at Lawrence Livermore, unparalleled in the context of the contribution that we in the Bay Area are making to bioenergy and biofuels, transforming the world again from a world based on petrochemical-based industry to alternative fuels. And then when you look at UC Davis and that world that we're transforming agriculture around it, very, very powerful. So we in the Bay Area have an enormous amount to be proud of in the heal the world, feed the world, fuel the world industry that the biotech industry is a part of.